Hello, I'm going to talk about hypothyroidism and hyperthyroidism and the difference. So let's go over the pathophysiology of each so that we have an idea of what we're talking about. So the pathophysiology, the thyroid first off controls the metabolism and many other functions of the body. And we have to understand that when we go hypo and hyper, it either slows those functions down or it speeds them up. Okay. So one of those functions is hormones being released by the thyroid. So hypothyroid is a result of not enough secretions of the thyroid hormones, and it's being characterized by decreased rate of the body metabolism. And hyperthyroid is a result of hypersecretion of these thyroid hormones, the T3 and the T4. Now, I'm going to go back to hypo for a minute. The thyroid stimulating hormone is not produced by the thyroid. It's produced by the pituitary. And if you have that in your head, then you're going to understand that with hypo, when we go to labs, it's going to affect that lab. So the labs affecting hypo, the T4, the hormone that thyroid itself produces is low, but the TSH is elevated because the pituitary is trying to tell the thyroid, do your job, do your job, do your job, and it's not getting it. It's taking a nap, as I always say. Whereas with hyperthyroidism, the T3 and the T4 are elevated and the TSH is low. And that's because the pituitary isn't secreting it, and the thyroid stimulating hormone is what the pituitary secretes. So therefore it's low. What thyroid's secreting is high, T3 and T4. So then signs and symptoms of hypo would be lethargy, fatigue, weakness, muscle aches, paresthesia, intolerance to cold, weight gain, dry skin, hair loss, dry skin and hair, and then loss of body hair. You're going to have bradycardia, cardiac, that's the cardiac, enlargement, because everything's slowed down, so heart failure, constipation, generalized puffiness around the and edema around the eyes and face. Remember that hypothyroidism, the complication for it is max edema, and that is where that puffiness around the eyes and the face get worse, okay? When you're dealing with hypothyroidism, remember everything is slowed down. So when a question is asking you about what signs and symptoms you would see, you're going to look for things that have slowed down. Whereas hyperthyroidism, you have personality changes, they're irritable, they're agitated, they have mood swings, they're nervous, they have fine tremors of the hands, they have weakness of the muscles, they have aches and paresthesia, heat intolerance. Remember, everything is sped up. So they're hot. They can't stand to be in a temperature that's hot. Smooth, soft skin and hair. They're going to have palpitations, dysrhythmias. It's going to be tacky, and they can go into atrial fib. Diarrhea, protruding eyeballs, diaphoresis, and hypertension. And they also can have an enlarged thyroid goiter. Okay. So treatment of hypothyroidism. You're going to monitor their vital signs. You're going to give them the replacement, the levothyroxine. You're going to instruct the client on thyroid replacement side effects of hypo or hyper related to under or overdosing. So if I'm giving something that helps replace what's not happening, I need to understand that I can put them into the opposite, hyper. Okay, so I need to instruct the client on a low calorie, low cholesterol, low saturated fat diet, again, because the GI tract has slowed down. So with that, I have to not take in so much because it's not metabolizing what I'm putting in. I need to discuss daily exercise program and assess for constipation and a warm environment. Hyperthyroid treatment is provide adequate rest, administer sedatives as prescribed, give them a cool and quiet environment, obtain a weight daily, provide high calorie diet, because again, they're taking in and they're going to eat it all up. Their metabolism will eat it up and more. Avoid the administration of stimulants. You're going to administer anti-thyroid medications. And now it's not on here, but I want you to hear me because I'm giving them anti-thyroid meds. They can go into hypothyroidism. So I have to monitor for that because that is an outcome, a potential outcome of giving those meds. So more, administer iodine preparations that inhibit the release of thyroid hormone as prescribed, administer propranolol for tachycardia, prepare them for the radioactive iodine therapy, prepare the client for a subtotal thyroidectomy if it's prescribed. And then, of course, you need to allow the client to express their concerns about body image because it will change. So this is the difference between hypo and hyper. I hope this has helped you. See you soon.